Good afternoon, everyone, and welcome to this week's live. We're going to wait just one moment to let people join in as I add this little message for information about our services. Wonderful. Thank you for joining. Thank you for joining us today. So my name is Ayele Ba. I'm the Community Health Education and Training Coordinator here at Whitman-Walker Health. And during the COVID-19 pandemic, Whitman-Walker's Community Health Department has extended its outreach efforts to the social media platforms. We cover various topics about HIV, STIs, sexual health practices, access to care, social determinants of health, and public health interventions. Our community health team is here to serve you. This week, we are going to be talking about American Diabetes Month that is celebrated each November. And so we're going to discuss a bit more about why it's celebrated and the meaning of the month. So November is National Diabetes Month, and it's a time when communities all across the country come together to bring attention to diabetes and what is diabetes and its effects on health and community and public health. According to the CDC, there are 37.3 million people in the United States alone that have diabetes. That is slightly more than 1 in 11 people. And the CDC also estimates that there are 8.5 million going undiagnosed with diabetes, not knowing that they have it. And that's about 3.4% of the entire population of adults. So the percentage of people with diabetes does increase with age, and among those 65 years and older, the rate is even higher and reaches 29.2%. But if you're wondering what is diabetes, it is a disease that occurs when blood glucose levels, glucose is another name for the sugar that lives in our blood, it gets too high. It affects adults and youth, and can cause damage to eyes, kidneys, nerves, and the heart, and is linked even to some types of cancer. There are 3 types of diabetes: type 1, type 2, and gestational diabetes. Type 1 and type 2 may have similar names, but they are very different diseases with different causes. The key difference between type 1 and type 2 diabetes is that type 1 is believed to be an autoimmune disorder or autoimmune reaction and develops earlier on in life, while type 2 develops over the course of many years and is related to lifestyle factors such as being inactive or carrying excess weight, and usually is diagnosed more so in adults. Risk factors for type 1 are not as clear, but family history may play a role. In type 1, the body's immune system is responsible for fighting off foreign invaders, such as harmful viruses and bacteria, and it is that immune reaction. In type 1 diabetes, the immune system mistakes the body's healthy cells for foreign invaders and in turn attacks them. The immune system attacks and destroys the insulin-producing beta cells in the pancreas. And after these beta cells are destroyed, the body is unable to produce insulin. And insulin is a hormone that is very important for changing the glucose or sugar in our body into energy. Researchers don't know why why the immune system attacks its own cells sometimes, and it may have something to do with genetic or environmental factors. And an example of an environmental factor would be an exposure to a virus. Research into these diseases is ongoing, but diet and exercise and lifestyle habits do not cause the type 1 diabetes. But type 2 diabetes is an insulin resistance. The body still produces that insulin that converts glucose into energy, but it's unable to use it effectively. Researchers are unsure why some people become insulin resistant and others do not, but several lifestyle factors may contribute, including levels of physical activity and carrying excess weight. Other genetic and environmental factors may play a role, because when you develop type 2 diabetes, your pancreas will try to compensate by producing more insulin. Because your body is unable to effectively use this insulin, this glucose accumulates in the bloodstream. Both types of diabetes are chronic diseases that affects the way your body regulates blood sugar or glucose. And glucose is the fuel that your body feeds your cells, so the energy that you need. But to enter your cells, that glucose needs a key. Insulin is that key. Or even if you would picture someone shoveling coal into a fire, insulin is kind of like that shovel that helps to keep the fire going. People with type 1 diabetes do not produce that insulin or that shovel or that key. So think of it of not having that key. People with type 2 diabetes don't respond to insulin as well as they should, and later in this disease often don't make enough insulin. You can think of it of having a broken key or the broken shovel. Both types of diabetes can lead to chronically high blood sugar levels, which increases the risk of complications as well. And we will talk about what some of those complications look like. But the third type of diabetes is gestational diabetes. It is diabetes that's diagnosed for the first time during pregnancy or gestation. But like the other types of diabetes, it affects how your cells use sugar or glucose. But gestational diabetes causes high blood sugar levels that can affect the pregnancy and baby's health. Usually, various hormones work together to keep blood sugar levels in check, but during pregnancy, hormone levels change, making it harder for the body to process and use blood sugar efficiently. So this causes those blood sugar levels to rise. And usually it's not in the first part of pregnancy, it's when the hormones start getting having a larger effect on the body, when gestational diabetes tends to develop. While any pregnancy complication is concerning, there is good news. During pregnancy, you can control gestational diabetes by eating healthy foods and exercising, and if necessary, taking medication. Controlling blood sugar can help keep the birthing person and baby healthy to prevent complications or a difficult delivery. If you do have gestational diabetes during pregnancy, generally blood sugar returns to its usual level after delivery. But if you do have gestational diabetes, there is a higher risk for developing type 2 diabetes later in life for the birthing parent and baby, and you will need to be tested for changes in blood sugar levels more often. If not managed, all three types of diabetes can lead to various symptoms, and these are symptoms to look out for as well. Urinating frequently, feeling very thirsty and drinking a lot, so excessive thirst, feeling very hungry or very tired, fatigued, having any type of blurry vision, or having cuts or sores that don't heal properly, dry skin, or experiencing more infections or sicknesses than usual. And even people with type 1 and type 2 diabetes may experience things, mood changes like irritability, and also unintentional weight loss before being diagnosed and seeking treatment. Another thing that can be common in both types of diabetes is a numbness or tingling in the hands and feet. But good glucose management and following treatment can significantly reduce the risk of this numbness and tingling as well for those with type 1 diabetes. Although the symptoms of the type 1 and type 2 diabetes are similar, they do present in different ways. Many people with type 2 diabetes will not have symptoms for many years, and often the symptoms can develop slowly over a long period of time. Some people with type 2 diabetes also have no symptoms at all and don't discover they have the condition until complications arise or during a regular physical, which we will always suggest to get your A1C checked. The symptoms of type 1 diabetes develop quickly, usually over the course of several weeks. It was once known as juvenile diabetes because it does usually develop in childhood or adolescence, but it is possible to develop type 1 diabetes later in life as well. There is currently no cure for type 1 diabetes, and because people with type 1 diabetes do not produce insulin, it must be regularly taken via injection or medication, and blood sugar levels must be regularly checked. Some people take injections into soft tissue, such in the stomach, arms, or buttocks, several times per day, and other people use insulin pumps, which give a steady stream of insulin into the body through a small tube. Blood sugar testing is essential in managing type 1 and type 2 diabetes because blood sugar levels do fluctuate so frequently and quickly as well. Type 2 diabetes can be managed and prevented with diet and exercise, but many people need extra support. If lifestyle changes, such as healthy eating and increasing exercise, aren't enough, your doctor may prescribe various medications that help the body to use insulin more effectively. Monitoring blood sugar level is important for both types of diabetes, especially for type 2 diabetes as well, because it is the only way to know that you're meeting target glucose levels. Your doctor may recommend taking blood sugar more frequently or just occasionally, depending on the levels are high. And if levels are high, insulin may be suggested for type 2 diabetes as well. And so while type 2 diabetes can be can be managed and prevented with diet and exercise, type 1 cannot be prevented, but it is possible to lower your risk of type 2 diabetes through various lifestyle changes, such as maintaining a moderate weight, working with your doctor to develop a healthy weight loss plan, increasing activity levels, eating healthy, balanced meals, reducing the intake of sugary foods and overly processed foods, and even if unable to prevent the disease, careful monitoring can get your blood sugar levels back to the standard and prevent the development of severe complications. So we would recommend these for everyone. And be sure at your next checkup to ask about your A1C check to see how your levels are doing and to see if they're elevated in the prediabetes range, because that can be a good sign to start taking some of those steps. But before we go, and thank you so much for joining us today for this live, everyone who joined in and everyone who's going to watch this video later. But before we go, I want to give you some reminders about the various viruses and the services we offer at Whitman-Walker. So there are, as you know, several viruses that we are currently fighting as a society when it comes to COVID, RSV, and flu. If you've gotten vaccinated, congratulations. You've taken a great step at preventing yourself and your loved ones and communities from illness. Multiple variants have soared across the world, and it is totally understandably why you would want to keep wearing your mask or keep distant, as none of these vaccines are 100% effective. But also, more contagious variants are spreading, and there are very few protocols in place to verify the status of those around you. So keep staying alert. If you haven't been vaccinated and are looking for an appointment, Whitman-Walker Health has the COVID-19 and flu vaccines available. Please reach out to us at 202-207-2480 to make an appointment. If you're having trouble making an appointment with your local health department, if you're having trouble making an appointment with us, please reach out to your local health department, and that information is available at the Whitman-Walker website, whitman-walker.org. Please continue to follow CDC guidelines for mask wearing, quarantining, and social distancing, and the like. It's important that you consider getting the various vaccines, discuss other precautionary measures with those around you. Be mindful of masks and keep your distance, but it's been circulating. While numbers are still declining, I would recommend getting in contact with your local health department for information on getting the vaccine if you are interested. In DC, you can pre-register for the vaccine at dchealth.dc.gov/page/monkeypox, and also has several walk-up locations to receive the Mpox vaccine. Information on those sites are also available at whitman-walker.org. Please remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and continue checking our website, www.whitman-walker.org, for the most up-to-date information on our services. For more COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439. And please continue to follow our programs in Whitman-Walker Health Family at this page, Real Talk DC, and at No Filter DC, and of our general page, Whitman-Walker Health. Please also check the comments, the pinned comment for information on our HIV and STI testing. Thank you so much for joining us today. Again, my name is Ayala. I'm the Community Health Education and Training Coordinator here at Whitman-Walker Health, and thank you so much for joining in today. Have a wonderful evening and take care.